Now, there are also growing concerns about a rise in COVID numbers in Saskatchewan. In fact, one young COVID patient is speaking out about his time in the intensive care unit. We're talking about 34-year-old Matthew Cardinal. He was induced into a coma and put on a ventilator. He is now back at home in Regina and joins us at this moment. So, Matthew, thank you for being with us today.
Yeah, you're welcome.
Now, for people watching, I knew this was going to happen, but you are lying on your front, and that's because this is medically necessary given what you just went through.
Yeah, this is called proning, and it's good for COVID because it helps to relieve the lungs on the back, and it helps to try to get the phlegm out and reduce the coughing. I'm considered recovered right now, but it's still getting rid of the virus out of the body, the dead cells, I guess. I don't know.
And you went through a scary experience. Here you are speaking to us, but you've just gone through a very scary experience, which I'm going to talk about. But let's break it up first and foremost, beginning with when you started feeling ill. What happened?
Okay, so on the 15th, I got a crazy headache, and I'm not known to get headaches, right? It was just so intense, and I knew something was wrong. So I called home. I told my mom, stay far away from me, something's wrong, I'm feeling really sick. So I went home that night, laid in bed, and that's when the fever started, chills, classic typical COVID things, like the symptoms. And it got worse and worse and worse after that. Finally, on the 24th, I had to call an ambulance, and I couldn't breathe. So they sent right away for me to go to the hospital, and yeah, it was crazy from there.
Crazy from there. And one of the things that I was reading in the conversation you shared with one of my producers, you said at one point the doctors told you, text your family. Talk to us about that.
Yes. They had me in a unit just before I went to ICU. I believe my oxygen level went down to 80. And they told me, you have about 10 minutes before we take you down to ICU. So text or call your family, say whatever on Facebook, but we need to take you down there now before you start losing your brain function. And it was scary. So I posted on Facebook, hey friends and family, if I don't make it, this is goodbye. I had no idea what would happen to me in ICU. It was a very scary experience. I texted some friends and family and said, hey, this is serious now, I'm sorry.
I can't imagine how traumatic that moment was for you to basically be told that you may not make it.
Well, yeah, it was really scary. The nurse I was working that night, she was shaking with fear. She was freaking out. She didn't know whether to call, I don't know what the code is, code blue or something like that. It was very serious. My vitals were crashing. And I was really scared.
And they put you on a ventilator and in an induced coma, to my understanding. Talk to us about that. What was going through your head in that moment in time?
Well, when they brought me down to the ICU, there was about 8 staff, I remember. They were all dressed up in yellow garbs because that's a standard wear now. And they explained to me, you're in good hands. You need to calm down. What's going to happen, they said, is we're going to put you under, but we're going to be putting a ventilator on you. So do you know what that is? And I said, yes, I have a basic idea. I had no idea that it would be all these cords and everything coming out of my mouth. So what? They would take me out of the coma every once in a while. And I had no idea what time it was, how long I was under. I was confused. I'd freak out when I seen the cords coming out of me. They would have to put me under again. The nurse would come in and tell me, you're going to be okay. You need to calm down. It was just traumatic.
Honestly, Matthew, I can't imagine what you went through in that moment. You are so young and not the profile of someone that, we have come to associate with COVID-19, except with variants. Do you know whether or not it was a variant of COVID-19 that did this to you?
It was B1117. It was the UK variant that got me. It was I've never been this sick in my life. It literally crippled me. I need oxygen. I need a walker to walk around. I really had to work hard to get out of the hospital so I can recover at home. because the hospitals here are so full, they really need the beds.
You had to work hard. Explain that to us. What did you have to do? Because I think this is important. We know that you were put on a ventilator. We know that they put you in an induced coma, and then you come out of it, and what did they tell you?
They told me, we're going to be taking the ventilator off you, so you need 10 minutes to practice this. You need to exhale, and we're going to pull it all over your mouth. But they said, like, we can't put it back in right afterwards, they said, unless you have some kind of surgery. So we're taking a huge gamble here with you. So I said, okay, no. I said, like, I motioned, I'll try, like, because I had basic functions in there. So I gave them a thumbs up, and I said, I'll try. So when the respiratory doctor came in, he said, okay, Matthew, you ready? I said, yes. So he pulled it all out of my mouth, and I was gasping for air, but I knew then and there that I'd make it and I'd survive. So it was bittersweet that it hurt, but at the same time, I was happy. Mm-hmm. It's still out of it, but I was still happy.
So, as you say, you're still dealing with the after effects of COVID-19. What happens now? What's the road ahead of you? What have doctors told you about that?
Well, I have to practice on my breathing, so I have to eventually wean myself oxygen in about a month's time. Like they're gonna check up on me, and for my physio, I have to try to get my basic function back, like learning to walk again. Like I'm basically walking again, but I need to like stretch my core muscle groups, and like I can barely hold on to anything without shaking. Like it completely crippled my body. Like how fast it was. It's a very scary virus.
And yet, despite the fact that you were just released from hospital on Friday, despite this horror that you have gone through, you felt it very important to be with us today to share a message. So what do you want to say to Canadians who are listening to you right now? What do you want to say to people who may be, at this point, taking part in protests against masks and the protocols around COVID-19?
It's a very real virus. Take it very seriously. You are not invincible. You never know where you're going to contract it, where you're going to get it, how you're going to get it, who's going to get you. The scary thing about it is someone might not even know they have it, and they'll be around you. Be very careful. Wash your hands. Keep your circle small. Like, you're not invincible. Like, you really need to be careful and take everything seriously. Go get your vaccines, and when it's your time.
Matthew, I want to thank you for being as brave as you are to be with us today. Thank you for this. Appreciate it.
Yeah, thank you very much.
And that is Matthew Cardinal, a recent COVID patient, joining us from his home today in Regina.